The miracle coronavirus COVID-19 drug is here. It's called Remdesivir by Gilead Sciences, and there may be other drugs too. As a matter of fact, I suspect there are other drugs, but I'm not the CDC, luckily. Okay, this is the New England Journal of Medicine, one of the most prestigious and oldest medical journals in the world. And they did a paper, a case report here, on the first American patient. So he was a 35-year-old Chinese American who had just returned from Wuhan, China, the epicenter of the coronavirus outbreak. Tests for most known pathogens were negative, as were tests for other coronaviruses. You can see in the bottom paragraph there what they tested. He met the insane requirements for a CDC test for COVID-19. The insane requirements meaning we're the CDC, we have no brains, we have no test kits. And the first test kits that we sent out were faulty. So we're really in a bind here. So we're going to set some criteria that you can't be tested unless you have just returned from Wuhan, China, or you've been in contact with somebody who has just returned from Wuhan, China. Again, that crazy, criteria for a test is due to the fact that the CDC doesn't have enough test kits. So the patient's condition started worsening. Worsening by, the oxygen level was way down. He started developing a pneumonia in one lung. He was on a ventilator. So he's in pretty bad shape. So from the article, clinicians pursued the compassionate use of an investigational antiviral therapy, Remdesivir, a novel nucleotide prodrug in development. Now they say in development here, but this is actually a well-established and FDA-approved drug for HIV, but it's not approved for coronavirus. So that's why they mean the compassionate use. It means you seek a compassionate use when you know the drug's not approved, but it could save this guy's life. So that's what they requested, and that's what they received. So Remdesivir was initiated on the evening of day 7. On hospital day 8, the patient's clinical condition improved. His oxygen saturation values improved to 94 to 96% while he was breathing ambient air. The previous bilateral lower lobe rails were no longer present, and his appetite improved, and he was asymptomatic aside from intermittent dry cough and rhinorrhea, which is basically a stuffy nose. So, when you're recovering from any flu, you usually have a cough for a few days, and that lingers, so that's anticipated. All symptoms have resolved with the exception of a cough, which is decreasing in severity. So more news. This is coming from China, from the BBC News on China. An antiviral treatment called Remdesivir, made by US-based Gilead Sciences, is already in the final stages of clinical trials in Asia, and doctors in China have reported it has proven effective in fighting the disease being COVID-19. Massive clinical trial in Europe. This is coming out of French news. This is from the French site France 24. Massive clinical trial in Europe involving France, Belgium, the Netherlands, Luxembourg, the United Kingdom, Germany, and Spain, involving a list of drugs provided by the WHO. So the WHO knows there's a bunch of drugs that are showing promise, and they started this massive clinical trial. Now this is in the French news because 800 patients from France are going to be tested. So this is the EU clinical trials register for COVID-19. I didn't get the link, I didn't copy the link to the site, but you can just Google EU clinical trials register, and it actually pops up with COVID-19 as the default search term. And you can see from Gilead Sciences, Remdesivir is in 2 trials now, both in phase 3. So one is for moderate COVID-19 cases, and the one on the bottom is for severe COVID-19 cases. Now, Remdesivir could have saved the lives of many Americans had there been an abundant supply of test kits around the country. This is a retirement community, and it's the Life Care Center of Kirkland. Kirkland is south of Seattle. I think it's in Snohomish County. There's 3 counties there: Snohomish, Pierce, and I forget the name of the other one. But those 3 counties make up the early epicenter of the issue in Washington State, the coronavirus outbreak in Washington State. So this Life Care Center, as most, senior care centers, retirement homes, whatever you want to call them, every year they get hit by pneumonias, and pneumonia coming from influenza. And, it's devastating to, an elderly person who especially if they have other health conditions, that they call underlying health conditions. So, a pneumonia, a influenza that causes a pneumonia does a lot of tissue damage, and it's not recoverable. So a lot of people, die from pneumonia every year, die from, influenza and more common sicknesses. In the tens of thousands of people die every year. I think President Trump said yesterday, this year was like 30,000, but we've been as high as 70,000 deaths from, influenza every year. So these people at the Life Care Center didn't know that they were dealing with, COVID-19. But, if they would have had some tests, they might have tested for COVID-19. But naturally, these people at the retirement community didn't meet the criteria. They hadn't just come from Wuhan, China. And Remdesivir could still save the lives of many if people with brains made a decision of whether or not to administer the drug to specific patients. Now, this is a guy, he's a 25-year-old. He made the news yesterday. He's from New Jersey. He had a coronavirus test, and but they lost the test. It was a positive test, and they lost it. So the people that, the health care people who were taking care of him never got the results of the test. So, days passed by. They had to put this guy in a medically induced coma, so he had some kind of chance of recovery. But, even when you're in a coma like that, they put you in a coma so your body can basically concentrate on healing, but you're still going to get tissue damage. So I don't know what the situation is on this guy right now, but, they requested the use of Remdesivir. The better idea is to establish a set of criteria for it and have, medical professionals administer the drug whenever they see fit, if he meets the criteria. So the criteria should be defined pretty soon, and, there's a bunch of things that have to be taken into consideration. Age of the patient, time since it was confirmed or when the illness set in, current medical condition of the patient, and prognosis. Maybe you don't give it to somebody who's 80 years old and has already lost 75% of their lung tissue and is barely breathing. Current level of tissue damage. Other drugs that have been administered, a lot of times, you just don't mix drugs. They can have a really bad effect when 2 drugs are in your system together. Family wishes, supply of drugs like Remdesivir, and other factors. I don't know. Nobody has set a bunch of criteria for medical professionals to use. The local medical team should be able to administer drugs as they see fit, considering the criteria. Centralized decision making would result in too many deaths. If you had to wait on the CDC to make a decision on whether or not to give this drug to this particular patient, he would die before they got done with him, before they made a decision. The CDC might be doing some things well, but this organization is not going to be remembered for traveling to China during a pandemic to oversee some clinical trials. Now, the CDC announced, I don't know what time, I think it was, very early February, that they were going to China. And, the CDC comes out with these announcements that make them look like knights in shining armor, but they screwed up the country. Their incompetence, gave us what we have right now. And the issue with some of these clinical trials, China requested a bunch of drugs from the United States. So we gave them a bunch of, a combination of a bunch of drugs. A few of the drugs were HIV drugs, and there were some malaria drugs, and just a bunch of drugs to try. And what was going on in China, like every day in China, some medical organization would announce, oh, we've got a cure for coronavirus. It's this drug and this drug. And finally, the World Health Organization came out and said there is no cure. We've tried the combinations that you're trying. Just because you see it help 3 patients doesn't mean that it's a valid thing to do. So the CDC went over there probably to oversee clinical trials and make sure that only one drug was being administered and tried on patients, in the normal criteria for doing a clinical trial. You just don't mix it with everything else. Then you can't tell what happened. You can't tell if the results were the result of any specific drugs. So the CDC will be remembered for this. This is an infected country here, getting more and more infected every day, with tens of thousands of people waiting to be tested. That's what we'll remember the CDC for, incompetence. The CDC didn't even have enough drugs to do 1,000 tests, and look where we are now. We're, approaching 60,000 tests, or 60,000 confirmed cases. We're over 60. I think we're at like 63,000. Doomsday. The general public knows that, some of these doomsday programs that go on the Discovery Channel or Smithsonian Channel or some other channel, 9 ways the Earth could end. And, number 1 is global warming. The floods just take over. I don't know how that would doom the whole world. Some people would survive. 2, an asteroid. 3, a pandemic threat. Coronavirus called MERS. Middle Eastern Respiratory Syndrome, and a deadly virus could spread like wildfire. Well, yeah, this is from May 2013. This is, from a few years ago. So most people had a general idea that, a virus could wipe out life on Earth, but not the CDC. So China and South Korea are prepared to deal with the pandemic now because they've had a test run. And they survived that test run because, the reason that they're prepared to deal with it, they didn't have the CDC that left them in a critical situation fighting a pandemic with an insufficient supply of test kits, personal protection supplies, and, medical equipment. And the CDC also knew that there were issues with, getting help from the thousands of, American research institutes. We have university research institutes, hospital research institutes. When I was in graduate school, I used to, buy these research institute directories. And, if you buy them when they're like 4 years old, they don't cost, $1,500 a piece. You can get them for maybe $50 on eBay. And it's like a phone book. It's like 2 phone books put together, A through M and, the rest of them. Private U.S. labs and foreign labs. What the issue here was the CDC was basically blocking or being blocked by the FDA, from using these research institutes. And they knew that decades ago. And they didn't do anything about, coming out and saying the regulation is going to cause us a problem someday because we're going to have a pandemic and we're not going to have enough test kits, and we can't use test kits from these people because of the FDA. We are very lucky right now that this virus is not as deadly as some like Ebola. If you look at the mortality rates, this one on the left is from China, Chinese Center for Disease Control. 14.8% on people 80 years old and above. 70 to 79 is 8%. So these are both really pretty big fatality rates or mortality rates. On the right, you can see South Korea. Now, why does South Korea have such a low mortality rate, 0.83 for people 65 and older, which on the left would be a combination of 3.6%, 8%, and 14.8%. And they're at 0.83 because South Korea was using better drugs to keep people alive. There's some other issues that the CDC should have been addressing, like the fact that some drugs are not being tested properly. So this is South Korea. This is taken off of a Johns Hopkins screen print of South Korea, I think today. I don't know what time today. South Korea was once the epicenter of COVID-19 outbreak outside of China. You can see this graph here, which is a graph I made, and I cut the data off at 3/6. But you can see from, late February up until about 3/1, they were just, leaping up 1,000 cases a day, which at the time was more than Iran or Italy. They just went from no cases at all to all of a sudden having thousands of new cases a day or thousands of new cases a week and being in a very bad position. All you see coming out of South Korea on this Johns Hopkins global tracker every day was just big leaps in the number of new cases every day. Now, if you look at the same graph, which I extended through 3/24, could have put today's in there, they've basically flatlined. That's South Korea, the orange line. And you can see that Italy, the light blue line, is way up there, and the United States has the steepest curve. It'll only be a couple days until we pass Italy as a #1 epicenter of the world. So, but basically, South Korea has things under control. They got up to several thousand cases, and they just recently went over 9,000, but it's been in the 8,000s for at least 10 days now. There's no more, there's no big number of new cases every day. A couple days ago, they had 46 new cases, and that's in a country that has 9,000 cases. So 43 in a day is a pretty small number, and a lot of people are recovering every day. So if you look at the numbers on the right, they only have 126 deaths in South Korea and 3,730 people recovered. So that means there's 5,200 people now in South Korea due to South Korea doing everything right. South Korea is the model country. So one thing that they've done right, I made another video, by the way, on South Korea that you should maybe watch just to see what this country did. They just invented new ways of fighting this COVID-19, and they have things under control. Every country should study them. So the Korean Society of Infectious Diseases, Korean Society of Antimicrobial Therapy, Korean Society of Pediatric Infectious Diseases, and Tuberculosis Association all published this on Thursday, that they are using Kaletra. Kaletra is a drug that contains two other drugs, Lopinavir and Ritonavir. Now, one of these drugs is a malaria drug, and the other one is a HIV drug. Ritonavir is a HIV drug. And these were both made by Abbott Laboratories, which is a huge American pharmaceutical firm. Now, Abbott spun off this other company, AbbVie, that makes this pill Kaletra now. So they have, probably the patents on Kaletra. So South Korea swears by this drug. But this drug, I looked up, clinical trials to see how it's doing. AbbVie's HIV drug Kaletra stumbles in COVID-19 trial, but one analyst begs to differ. So this is coming out of Fierce Pharma, an article that, pretty much told what happened to the clinical trial in China. It didn't do very well. So here, and this is the article, but let me just read the screen here. Evercore ISI analyst Umar Rafat begs to disagree. So this is one analyst, but the headline says one analyst begs to differ. Well, it isn't the analyst that's important here. It's the other two people that beg to differ. The patients had already been showing symptoms for about 2 weeks when they were entered into the study. That's very long, Rafat said, noting that Roche's flu drug Tamiflu needs to be initiated less than 2 days from the symptom onset. So, everybody knows that if you administer a drug too late when tissue damage already starts, nothing's going to recover tissue damage. You can kill the virus, you can kill a bacteria if it's a bacterial infection, but you can't repair tissues with a drug. So this guy says that's very long, waiting 2 weeks before you administer the drug to people and calling that a clinical trial. It's just crazy. Honestly, I want to see a further subcut of this data, perhaps for patients that initiated Kaletra less than 8 days from the symptom onset. And, better yet, a couple days, as soon as they're confirmed with coronavirus, which is what South Korea was doing. In a separate editorial that ran alongside the study, infectious disease specialist Lindsay Baden, director of clinical research at Brigham and Women's Hospital, and the New England Journal of Medicine, editor-in-chief Eric Rubin, also looked for silver linings. Baden and Rubin pointed out the fact that the team chose a challenging population to study because the patients recruited were already late in the disease course and already had major tissue damage. So why would you administer the drug so late when there's tissue damage and then call that a clinical trial? Even highly active antibacterial agents have limited efficacy in advanced bacterial pneumonia, they wrote. So if, they're talking about a bacterial infection, not a virus infection, but even proven antibacterial agents can't do much, when you wait so long. So this is my opinion here. And, I've got a lot of experience in consulting and a lot of experience in federal government consulting. And, this is just my opinion. I'm not a medical expert. I don't come from the medical side. Since the Chinese clinical trial of Kaletra was highly criticized by some pretty significant people, and since South Korea swears by the drug, it ought to be included in the current massive EU clinical trials. And it's not in there. I searched. So, this is an issue, if you ask me. I don't sit around smoking crack all day and, come up with, crazy things to do aside from, helping the country out right now. So this is just another drug that shows promise. South Korea swears by it. South Korea is the model country for the world. South Korea has the highest rate of recovery in the world. South Korea has the lowest rate of new infections in the world, and South Korea uses this drug. So, it's just common sense. Sometimes it just, the dumbest people on the planet sometimes work in the federal government and in agencies like this. The CDC is comprised of people who are, MDs and PhDs and MDs combined. None of them have any business experience. None of them could foresee an issue with a shortage. Well, hey, maybe we should mandate that hospitals carry, a 6-month or 1-year supply of personal protection gear. Or maybe we should make sure that they have enough ventilators if an outbreak occurs. Maybe we should count the number of medical beds in America and anticipate that a viral outbreak like this is going to require what's happening in LA now in New York, setting up convention centers as hospitals and sending in the National Guard to man them. But we also need some drugs. There's a vaccine underway, a vaccine clinical trials started last week in the Seattle area. And that's really good news. But we also need a drug that can help people recover from COVID-19. It's just common sense. Common sense is something you don't see in the CDC. I could replace the entire CDC tomorrow and the country would be in better shape. And it's not that I'm just, bragging about, my capabilities. A 12-year-old could replace the CDC tomorrow and we'd be in better shape. That's all I have for now. I appreciate your time.